Hello friends, let's talk about personalized IVF treatment. First of all, let's make it very clear at the outset that personalized IVF treatment always increases your success rates because one size doesn't fit all. All patients do not fall in the same treatment protocols and the same process. Every patient needs to be individually assessed and advise the treatment accordingly. So how does personalized IVF treatment work? The process of personalization begins at the very first consultation. At the end of the consultation, basically after taking a detailed history and examining the patient, once it's decided that the patient requires IVF, the first step is to prepare the patient for IVF. Now that is very individual from patient to patient that what pre-treatment is required before starting IVF. It can be as simple as giving vitamins, antioxidants, so other nutritional supplements, as well as certain supportive medications like DHEA, antioxidants, specific antioxidants like CoQ, some short course hormonal treatments. This is basically to ensure that once the IVF stimulation starts, we get a good set of eggs to grow and in a good overall outcome. Then once the stimulation starts, the next step of personalization is to ascertain the type of protocol that which will be used to stimulate the patient. There are different protocols. Every patient needs a specific protocol as per the hormone levels, as per the age of the patient and the other background history. According to the protocol, then the drug to be used, that's also individualized. The dose of the drug, the type of the drug varies from patient to patient. Some patient may require a lesser dose of injection. Some patient may require a higher dose of injection. So that is also specific to every patient. After that, the protocol and the stimulation monitoring begins. Then even when the time of the trigger, the ovulation trigger, that trigger protocol is also very specific from patient to patient. Like a PCOS patient requires a different injection to stimulate the trigger protocol. A non-PCOS patient requires different injection. This is to get again the best quality of and the best yield of eggs at the same time to avoid any complications. After the process of ovarian stimulation is over, the egg pickup is performed. After egg pickup, the type of fertilization process which is to be used, IVF, ICSI, IMSI, again that is decided as per the patient. Then the next is embryo culture. Whether we are going to do a day 3 embryo culture or a day 5 embryo culture depends upon the history of the patient, the number of eggs, the number of embryos that are forming. Then the next step at the next level is whether we are doing a fresh embryo transfer or a frozen embryo transfer. Again, that is a decision to be made very wisely, whether the patient requires a fresh or a frozen embryo transfer, because that also has a very great impact on the results. Based on what embryo transfer protocol, type of embryo transfer is done, the protocol for preparing the endometrium for the embryo transfer is also different from patient to patient. Some patients require an HRT protocol. For some, we do a modified natural cycle to prepare the endometrium. That is also one variable. The next step also some additional techniques. So doing a PGTA, doing laser hatching. These are the technologies and services offered to certain patients who need it based on what their history is. So this is how personalized IVF works from end to end. And it's very important that you consult with a doctor or a clinic who specializes in such kind of personalized IVF treatments. Thank you.